Morning, folks. North Country Knucklehead here, driving to work. Thinking. Dangerous thing for me, but I was thinking. A lot of discussion I hear on the news. It seems like all the news circles around the new president's administration and Russia and whatever's going on with that. But talking about the Affordable Care Act. We're going to repeal it. We're going to replace it. We're going to repeal it only. We're going to go free market. Blah, 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 blah. Here's the deal. Something needs to change. I don't know. I ride motorcycles for a living. So what do I know about healthcare? But I do know that my daughter and her family, young family of 4, and her husband, my daughter, her husband, their 2 children. When the mandate came in, you've got to have health care or you're going to pay a tax, a penalty for not having it through his employer, my son-in-law. He gets the insurance that they can afford and still take care of their family, their basic needs. Their income at the time was about $35,000 a year. He worked really hard. She stayed at home with the kids at the time because they were young and packed his lunch every day and did all that stuff, and they were very, very frugal and thrifty and took care of stuff. So here's a young family of 4 making about $35,000 a year. His monthly insurance premiums was about $400, a little over $400 a month. The problem with the system was he got absolutely no benefit from that health insurance until he reached his co-pay cap, what he needed to pay, and that was $10,000 a year. So everything for them was out of pocket until they reached $10,000. Along with the roughly $4,800 a year they were paying for health insurance. Something's broken, folks. Plain and simple. It's not getting any better. The insurance offered by companies that people can sort of afford, depending on what their income level is. Wow, the mouth isn't working so well this morning. Is the problem. They would have been better off, in essence, not getting health insurance. Well, except then they run into that problem because it's employer provided, sort of, whatever it is, some of those mandates. But if they had elected to not have health insurance, they could have used that $4,800 to pay for their day-to-day out-of-pocket cost for their health coverage, their actual health care. Instead, they paid $4,800 to an insurance company who gave them nothing, and then they had all of their out-of-pocket. I know one time one of the kids was sick and had to get a prescription. My youngest granddaughter, and she has asthma, and they didn't go to the emergency room because you could never afford to go to the emergency room, and it wasn't truly an emergency, but got a prescription and goes to get the prescription, and this was shortly after they had gone to the new insurance, whatever it was, and the prescription was $150 for a round number. And my daughter was like, well, I have insurance. And they said, well, yes, but your insurance doesn't cover any prescriptions until you reach the cap. And she was like, okay. So she didn't get the prescription that day because she didn't have the money to pay for it. She has a sick child at home that she doesn't get the prescription because she can't afford it, because her health insurance didn't cover anything until they spent $10,000 out of their pocket on an annual income of about $35,000 for a family of 4. And then we wonder why the Ryan Care didn't get passed. And people can look at that whatever they want from the political side, but I think the honest truth is there were a few people on the Republican side that said, no, it's still really freaking broken. And rolling this out in a multi-part deal, 3 parts, 2 parts, 6 parts, whatever it is, but nobody's been able to see or read the damn parts, is not acceptable. Because you're probably not putting that family in a better place. Just my rant on health insurance, and because the Affordable Care Act, again, and I steal this from somewhere I heard, isn't really about care. It's about insurance. Because healthcare in the United States is pretty freaking good. It's pretty darn freaking good. But helping to offset that cost with insurance, that's where we run into the Affordable Care Act. Anyways, I've kind of drifted off into a little bit of a rabbit hole, but some things get me spun up, and I've decided, instead of ranting at my own home and making my wife and daughter roll their eyes in the back of their head, I'll rant to you. And you can let your eyes roll into the back of your head, whatever, I don't have to see it. Anyways, North Country Knucklehead, talk to y'all later.